Hello, this is Dr. David Green, CEO of the Mid-Atlantic Pain Network. Today's topic is the non-operative treatment of adult scoliosis. Well, what is adult scoliosis? It involves rotation and curvature of the spine due to degeneration. Good old arthritis. It's very different than pediatric scoliosis. It's often painful. Pediatric scoliosis usually is not. It's stiff, so it doesn't respond to bracing. Pediatric scoliosis usually is pretty flexible, so it will respond to a brace. And adult scoliosis usually causes back pain and leg pain because of the arthritis overgrowth and pinching on your spinal nerves. You don't see that in kids. There are two reasons adult scoliosis can occur. One is if you had pediatric scoliosis, such as adolescent idiopathic scoliosis. If it's over 40-degree curve when you get skeletally mature and you don't have surgery, then on average it will get worse at 1 degree per year. So it doesn't sound like a lot. So if you're 20 years old and your curve is 40 degrees, fast forward to the age of 75, add 55 degrees to that, that's a lot. That's a 95-degree curve, okay? So it can add up over the years. The second way that it occurs, it can occur new due to spinal degeneration. You may not have adult scoliosis at all as an adolescent, but you start to get some disc degeneration, then you get some abnormal motion in your spinal joints called the facet joints, and you get arthritis asymmetrically, and then you start to get curvature that then gets worse. Nerves can get pinched along with spinal arthritis occurring, so that's the second way that it can occur. Now, the symptoms of adult scoliosis, the arthritis itself can lead to facet degeneration or degeneration of the spinal joints, which can lead to significant back pain. Patients may also get muscle weakness and aching from and difficulty standing up straight. A person can also have buttock and leg pain from spinal stenosis. Spinal stenosis is when overgrowth from arthritis can pinch on spinal nerves as they're trying to get out from the back, and that can lead to buttock and leg pain because of it. Now, treatments may include over-the-counter medications such as anti-inflammatories and Tylenol. Then prescription medications would include higher strength anti-inflammatories, neuropathy medications such as Neurontin and Lyrica, narcotics, or topical creams or patches. Physical therapy is an option along with chiropractic and spinal decompression therapy. And then there's interventional treatments. So here's the interventional treatments. A facet injection, which you can see here, involves placing the needle right into the arthritic spinal joint. All right? They're not huge, they're about the size of a thumbnail, but there's quite a few of them that can be involved in the arthritis process. So you can put steroid, just like you can any other arthritic joint, right in there. It may provide pain relief for weeks to months. Trigger point injections, which are done back here in the soft tissues, can be very helpful for aches and spasms. So medial branch block, which you can see here, is where the needle does not go all the way into the spinal joint. It goes in the area around it. That can numb up these little tiny nerve endings called the medial branches, and that can provide pain relief for up to 3 months on average. If that works and the pain relief wears off, a person can go on to have this procedure, a radiofrequency ablation, where the needle's put in the same area and it's heated up and it deadens those nerve endings for 1 year, 18 months. It can work really long term. It's fine to deaden those nerves. They don't do anything motor. All they do is provide sensation. Okay. Now, if you have pinched nerve roots from spinal stenosis, an epidural injection can place steroid around those areas of pinching and provide excellent pain relief for up to months at a time. Those can be then repeated. So what are the outcomes? Over 90% of those with adult scoliosis can achieve a satisfactory level of baseline pain without undergoing surgery. Okay? So between the treatments for back and leg pain, most patients just don't end up needing an operation. I mean, this type of a procedure in an adult takes a very long time. Usually it's staged in 2 procedures, so it takes a couple days, a week to 10 days in the hospital, a lot of complication rates, tons of rehab, 6 to 12 months. So it should be an elective quality of life procedure and a last resort. The top non-operative pain management in the Mid-Atlantic region is through the Mid-Atlantic Pain Network. There are many clinics we have in our network accepting over 50 insurances and providing over 25 treatment options. Success rates are very high with the board-certified award-winning doctors. Visit us online today at midatlanticpainnetwork.com, see where our clinics are, and then call us for more information and scheduling at 855-444-6585. I'm Dr. David Green with the Mid-Atlantic Pain Network. Your pain stops here.